Hi everybody, Dr. Anjana Bana here and welcome back to my YouTube channel. 2022 in South Africa at least is the year of the biostimulator. So I'm going to do this part one of many. I can't tell you how many parts there are to this video series on biostimulators because there's so much information out there. So this is just a little introduction into it because we get a lot of questions and we're well versed into using all the biostimulators that we have available, and each one has its place, and each patient has one that would be most suitable for them. So I'm just going to go through a couple of them and our most popular ones and the ones that I have launched and relaunched this year in the country. And an important thing to think about, because people are always asking what's new, and nothing is really new. All of this is old tech, either repackaged or relaunched. Yes, some of these things have been around for over 20 years, so a good track record. One of the really cool ones that have been around since I've studied in aesthetics, the packaging has changed, the syringe has changed, but this is a Reston skin booster. So this is the original skin booster, it's trademark. So a lot of other things call themselves skin boosters, which they are, like they may well be, but this is the one with the actual trademark. I like Vital Light, 12 milligrams per ml, and we use it in different ways, injecting into the skin of the face we've got an automated gun. We even use a cannula, so it's not limited to the face. As you know, if you get saggy knees and elbows, this is something cool to check out. Hyaluronic acid, especially cross-linked hyaluronic acid, does something in the dermis, so it stretches the fibroblast. It doesn't stretch the dermis or the skin, so you won't get all saggy from that, but it stretches the cell that makes collagen, that makes elastin, and that makes hyaluronic acid. So it kind of wakes up the cell. So from the action of just the plumping of this and the hydration of water, plus the continual action of the fibroblasts now woken up and making new collagen and elastin, it's very cool. And the cool thing about this, it can be combined with any one of these. So there's actually a little thing that they do. It's called firm and refresh. So you can use the two of them together for some extra glow and boost. And this can be used anywhere. So this in South Africa is meant for, we can do it in necks, and it's from Brazil, and it's very popular as, for the Sculptra butt lift. But in the country so far, not much of it's going on. But I know later on they're going to do a lot more body treatments, probably starting in next year. But this year it was launched primarily as a face treatment, and primarily in the lateral face to help with skin laxity. So how you test it, it's very good for patients over 35, and if you're under 35, for skin quality, acne, scarring. So we usually test if we pull the skin, so it must pull. So I don't have much laxity, to be quite honest, but if you feel a bit of stretch there, it would be an excellent product for you. Been around for over 23 years, FDA approved for 18. With Sculptra, over 450 published studies on it, and then it's a slow burn. So you don't see a result straight away, but 3 months after your second treatment, and that's the minimum of 2 treatments. But if you're a postmenopausal woman or in your 40s and you're very lax, you might need more. You can go up to 4 or 5 treatments 6 weeks apart. But then 30 months after the second treatment, they've done biopsies. At 30 months, there's still that type 1 collagen going strong. At 3 months, a 66% improvement in your collagen, your elastin. So it really is. I love it. It's a very powerful biostimulator. So lots of little nuances for it. If you want to check out more about this, we've got loads of videos on our Instagram and loads of videos on YouTube just about Sculptra. New kid on the block, even though it's been around for 5 years, it was launched recently in South Africa, calcium hydroxyapatite, and not the first calcium hydroxyapatite product. Calcium hydroxyapatite is a mineral, a human mineral naturally found in our body, made our teeth are made from this. But the difference is it's got hyaluronic acid. So HA, the HarmonyCA, so these names have to be catchy and marketable, so that's why the name is that, and creating harmony in the face. This is also a biostimulator, but a filler. So their their tagline is that it's a hybrid injectable. So a hybrid injectable meaning that there's hyaluronic acid as well as the calcium hydroxyapatite, also lateral phase, so behind the ligament, and then zygoma, and then this pre-auricular space. That's the only place so far that it's been injected. I'm sure people experiment with it and whatnot, but that's what it's approved for. Because it's super new, still, you know, like studies, there are studies and whatnot, but like it still needs a bit of time to see exactly what it does. We've seen some results from, you know, other doctors, so we use it in the practice, and it's if you cannot wait for that biostimulation kick. It gives you like the hyaluronic acid with the CA. But an important thing to remember about faces, you also don't want to overfill and overplump. If the patient needs a bit of plumpness, it's great to have hyaluronic acid. But if you want just pure definition and sculpting on a pillow face, you should think about pure biostimulation. Here's another biostimulator called Profhilo. This also launched like last year in the country, but it's been around for 8 or 9 years. High concentration of hyaluronic acid, so 64 milligrams per ml. It triggers almost like a wound healing response, and we've seen some great results in it, but you know, out there in terms of publications and stuff, there isn't much out there, but I like it. We've been using it in faces, necks, breasts, on tummies. We've been mixing it with toxin, with PRP, and we're really getting some great results. It almost gives you like a Photoshop finish in terms of a patient. Also nice and low downtime. And then this is also a big gun, similar to this big gun. So this has been around for almost 20 years. Also FDA approved as well as CE marked. Different indications in Europe and different indications in the States. So in Europe, only for contouring, and then in the States, you can also use it as like a hyperdilute biostimulator. This is called Radiesse Classic. So this is the first one to have come out, and then you can use it straight up like this, but there's no lidocaine in it. Usually it's the classic dilution is 0.3 moles of lidocaine, and it's mixed in, and this gives you that very defined cheek, ligament lifting, very defined jaw, chin. You use it in nasolabial folds on the piriform. It shouldn't be used in noses and foreheads and whatnot, but people do. But you know, it's not indicated for those areas. There is something also called Radiesse Plus. So that already has powdered lidocaine in it. It doesn't change the composition. So this is 30% calcium hydroxyapatite with 70% of that CMC stuff. So CMC is also in this. It's a cellulose. It's found in our foodstuffs. It's basically a carrier for the particles. These are super round, super smooth calcium hydroxyapatite particles that only disappear after 2 years. It's not a permanent, you know, people think it's permanent, but it's not permanent, or it's not semi-permanent. It does stick around for some time. But, you know, I mean, they found that fillers can stick around for many, many years post hyaluronic acid fillers, post treatment. So this gives you that immediate contouring. But if you dilute this, and you can dilute it from a 1-to-1, a 1-to-2, 3, and 4, you can treat different areas of your body, like elbows, arms, tummies, cellulite, necks, as well as facial skin as a biostimulator. So same thing, neocollagenesis, which means new collagen, new fibroblasts, and new blood vessel formation in the area. So this is also a really, really great treatment. But all of them have their nuances, and you know, it's not a one size fit all in terms of patients. So if you want to know, you know, what is best for you, best to consult with your doctor, especially if you've been doing aesthetic treatments for a while. They may know what you're looking for, and the look you're going for, and you know, long-term sustainability as well. So thank you guys, just part one of this, and we've done treatments with all of these things so far, but I am super excited. I'm going to make a video of us doing a treatment with this Radiesse, using it in different ways as well on a patient. And well, you'll get a notification when that comes out. But thank you once again for joining me. If you have any questions related to biostimulators or anything else aesthetic, please drop them in the comments down below. Like, share, and subscribe. Thank you. Bye-bye.